By the way, if you haven't already eaten some type of artificial food coloring this morning, you probably will at some point today. It's honestly hard to avoid them because dyes are in so many of our favorite foods. And while their names probably don't mean much to you, you're definitely familiar with the foods they're in. For example, red dye 40 is in salami. I had no idea. Yellow dye 6 is in chicken bouillon, or in Spanish, how my mom says it, sopitas. And blue dye 1 is in canned peas. The list goes on. And lately, there have been growing concerns about the impact they can have on our health. Those concerns have led to a new West Virginia law banning 7 artificial food dyes. It is the most sweeping state-level food dye regulation in the U.S. So why the sudden concern about these additives? And what could this new West Virginia law mean for the food in your fridge? Here to break it all down is CBS News medical contributor Dr. Celine Gounder, who is also editor-at-large for public health at KFF News. Dr. Gounder, hello. So we know that one red dye has been banned nationwide. Why is West Virginia going this extra step, and what do you think is behind this?
Yeah, so there are some differences in terms of how the FDA looks at these things and how state legislatures might. So the FDA actually has to have a scientific process. They have to show the evidence that, yes, there is a risk. They can't just decide, well, maybe there's a risk, maybe there's not, we're going to ban it. With the states, they can decide even without full evidence, and they are really following in public health what we call the precautionary principle. You may have heard this during the pandemic, which is basically better safe than sorry. The second issue is that the FDA, because they have to go through this scientific process, that costs money. That is funded by taxpayers. So if you're looking at funding cuts at the FDA, they may not be able to afford to do that. By the way, drugs are funded through a separate process where pharmaceutical companies will pay to have their drugs reviewed. It's different for the food side of the FDA.
So West Virginia, my mom's lived there for 25 years, bought my first drink with a West Virginia driver's license. I know the state. I do not typically know the state to be at the vanguard of health concerns like this one. What's going on here? And in practice, what might this bill actually look like?
Well, it's interesting because this is actually kind of importing European-style regulation to what is a very red conservative state. So not what you would think of. But I think this is the influence of MAHA, Robert F. Kennedy, Healthy Again.
Yeah.
And so really importing those more European-style regulations into the Republican Party. And frankly, you know, people on both sides of the aisle are really supportive of being healthier in this respect. There was bipartisan support. And what we are anticipating, well, what this ban means, at least in West Virginia, is starting August 1st, these dyes will not be in school lunches, school meals. And then starting January 2028, they will not be allowed in any foods or beverages, as well as over-the-counter drugs.
How could this affect people in other states?
West Virginia is a pretty small state. So if this had been California or New York or Texas, that is a different thing, because then you're really having such a big impact on the market. Do manufacturers want to make, food manufacturers want to make something different for one state like California versus the rest of the country? West Virginia is pretty small, so it's hard to know if this is really just going to mean certain foods just won't be sold in West Virginia, as opposed to separate products being developed for West Virginia.
And just in a couple seconds, do you think this is a good idea?
Well, there is some evidence, at least for some kids, that this can increase the risk, these dyes can increase the risk of hyperactivity, sleeplessness, inattention. So especially for those kids where that impact has been seen and taking those foods away relieves those symptoms, for those kids especially, it is a good idea.
We're so habituated to certain colors in our food. It would be amazing to live in a world where we see the food for what it really looks like. I wonder if we would like it.
It could look really different, especially preserved foods may not look, yeah.
All right, Dr. Gounder, appreciate it. That, ladies and gentlemen, was By the Way for today. We appreciate it. We'll see you next time, Doctor.